Hi team, welcome back. If you're seriously considering applying to medical schools and dental schools in the UK, you know that the NHS is facing immense pressure. So what's the plan for the next decade? Well, it's all laid out in the NHS Long Term Plan. This isn't just a dry policy. Understanding the Long Term Plan, if we just shorten it to LTP. The LTP is vital because it outlines the job you'll be doing in the next 10 years at least, if not more. It will show the admissions tutors, the interviewers, that you can grasp the strategic direction of travel for the entire NHS in the UK. So what is the LTP? What is the core goal? The LTP was launched in 2019, and the LTP is a comprehensive strategy backed by guarantee of funding, resources, and it is designed to transform the NHS and make it more fit for purpose into the 21st century. The fundamental goal of the LTP is to shift from reactive to a proactive position, i.e. proactive prevention of disease and ill health. For too long, the NHS has been forced to focus on treating people after they get sick. The LTP aims to stop people from getting sick in the first place. It aims to stop people from catching the illness in the first place, or at least intervening at an early stage of the illness. This goal will be achieved in two ways. Number one, more care in the community, i.e. moving treatment out of major hospitals to closer to people's homes, i.e. dental surgeries, GP practices, community settings, right? And number two, using digital transformation, i.e. using technology to make the entire system more efficient and personalized. So how does the LTP envision the pillars of transformation? To do that, let's break the LTP down to three pillars. And it's important to you that you appreciate what these three pillars are. The first pillar is new ways of working, i.e. integrated care. The plan aims to break down the barriers between different services. The key mechanism for this is integrated care systems. So what are the integrated care systems? They are partnerships essentially between local hospitals, GP services, dental services, community services, mental health providers, social care. The impact will be that as a future clinician, you'll be working as part of an integrated care team so that the patient travel amongst the different agencies is efficient, is proactive, and it can keep people healthy as opposed to managing disease. Number two is the focus on prevention and major conditions. The LTP targets the biggest causes of death and disability in the UK, and it's aimed at early intervention there, i.e. cancer. The plan sets an ambitious goal to diagnose 3/4 of cancers at stage 1 or 2 by 2028. This will require massive investment in new screening and quicker diagnostic pathways. Number two is mental health. A major focus is placed in closing the gap between physical and mental health. The LTP commits to giving millions and millions of people faster and easier access to community and specialist mental health care. And of course, the third area here is preventable illnesses, i.e. using data, using intelligence to identify people at high risk of disease like heart disease, heart failure, strokes, etc., and intervening early to prevent these illnesses coming on board. The third area is digitalization and data. The LTP plans to place technology at the heart of improving efficiency and patient experience. So the NHS app, expanding its use to allow millions of people to manage their appointments, view their records, access care easily, make appointments, request prescriptions, and constantly we're seeing the expanding of the NHS app's role, right? And it is hoped that this ethically improves patient autonomy. Then of course you've got the electronic patient record, which means that ensuring that patient and data access is available regardless of where you work, whether you're in a large hospital, in a small GP practice, in a dental practice, in the social services sector. You can access this information instantly, get comprehensive access to all the medical history, and therefore deliver vital care with good safety and efficiency. So why does it matter to you as an aspiring medic and dentist? Well, I think you need to be able to discuss the LTP in interview situations proficiently and efficiently, and show a level of preparedness for medicine and dentistry. And it will show your interviewers that you have strategic awareness. You know that there are issues around fragmentation of care, health inequalities, and they need to be addressed on a local and national level. You need to show interviewers that you are committed to the future of the NHS. You're ready to embrace the shift to working in an integrated environment and be able to adopt digital healthcare solutions. You need to be able to demonstrate a certain amount of ethical insight, i.e. you understand the plans around championing of beneficence, doing the best for our patients, our population, and also justice to make sure we apply it fairly, equally amongst all the population. In the interview, when you reference the LTP, you need to say things like, I want to be part of the multidisciplinary team that treats the patient holistically, as envisioned in the integrated care system model of the long-term plan. This will provide a powerful statement to your interviewers. The LTP is the blueprint for the next era of UK healthcare. By showing you understand these strategic shifts, you prove you're not just passionate but informed and ready to lead the next generation of clinicians. I hope you found this video useful. If you did, thank you for listening. Like and subscribe, and of course do benefit from loads of videos and blogs on our website and on our social media platforms. Thank you.